Hello, hello, hello. All right. Welcome, welcome, welcome. And so if you are, once you jump on, let me know in the comments. If you are live, put a hashtag live. And if you are watching the replay, put hashtag replay. Okay. All right. So today I am super excited because it's September 4th, and so starting next month it will be the start of open enrollment for Medicare, and then in November it will be the start of open enrollment for the health insurance marketplace. And so it's time to start thinking about your health insurance for 2026, especially with all of the changes that are happening in Medicare. So, in the upcoming weeks, I'm definitely going to be going over all of those changes with you so that if you are going into Medicare, if this is your first year into Medicare for 2026, or if you currently have Medicare and you're like, what's going on? We're going to be talking about that all this month in the month of September, okay? But today, I want to talk about how to read your summary of benefits so that you understand exactly what it is that your health insurance will and won't pay for, and what your cost will be out of pocket, okay? So, if you have ever looked at your health insurance summary of benefits and felt like you were reading a foreign language, don't worry, you're not alone. A lot of my clients say the same things to me. Okay, so today I'm gonna break down your summary of benefits step by step, and so that you know exactly what you're paying for and how to use your health insurance without the overwhelm. Okay. And so, real quick, if you are new to me or to the channel, my name is Katrice, and I am a licensed health and life insurance broker, paralegal, and your wealth architect. And I help women entrepreneurs and professionals to grow, protect, and secure their finances and to build a legacy that they can be proud of. Now, I am going to do a screen share. So that and go over an actual summary of benefits for the marketplace, so that you can see, and I'll do a step-by-step breakdown of how to read it. Okay. All right, so let's jump into it. So first things first, what is the summary of benefits? Okay. So the summary of benefits, this is a snapshot of or a quick guide to what's covered in your health insurance policy and what's not covered. Okay. So you can think of it like the cliff notes, okay, of your insurance plan. Now, it's not the full contract, which would be the evidence of coverage, but it is where you can find the key numbers and terms that will impact your wallet. Okay. And you can get a copy of the evidence of coverage as well, so you can have both. But the summary of benefits is usually just a little bit easier to read. Okay. It's kind of broken down a little easier without all of the extra language that's added into the evidence of coverage. Okay. Now, on the summary of benefits, this is where you'll see your premiums, your deductibles, your copays, your coinsurance, your out-of-pocket maximums, and all of the coverage highlights. It also will have some exclusions listed. Okay. And so instead of what I'm going to actually focus on today is like the top five main points in your summary of benefits, instead of like going through everything. Okay, so I'm just going to focus on the top five. Now, when I do the screen share, I will kind of go over it the way I do when I am working with a client. Okay. So the first thing you want to look at it is your monthly premium, which the monthly premium is not on the summary of benefits, but that's the first thing that you want to know, that you want to keep in mind, be mindful of, because that is the amount you have to pay every month to have coverage. Okay, so you can think of it as your membership fee, and whether you use the plan or not, you still have to pay that monthly premium in order for the plan to be active for when you do need it. Okay. Now, the next thing you want to focus on is your deductible. Okay. And so the deductible is the amount that you have to pay out of pocket before the insurance will kick in and start sharing costs with you. Okay. Now, the deductible does not apply to everything, mostly, most of the time. It really just depends on the plan and the type of plan that it is. But normally, only certain things apply to the deductible. It will say subject to deductible on the summary of benefits, so you'll know whether or not you'll have to meet the deductible first before the plan will kick in and start with the co-shares. Okay. Now, co-payments are fixed amounts for things you pay. So for like the doctor or your prescriptions or to go to urgent care, lab work sometimes will be have a co-payment as well. So that would be like, say, $20 for a primary care visit or $50 for a specialist. Those are co-payments. Okay. Now, next, the co-insurance. Co-insurance is really important because these are the costs that you pay for services after you have met the deductible. So if your deductible is $1,000 and say you are admitted into the hospital, then you are responsible for the first $1,000 of your hospital stay. And then once that is paid, then the plan will kick in and they will pay their percentage. Now, the percentage depends on the type of plan you have. So if you have an 80-20, which if you have Medicare plans, those are 80-20 plans. If you have a marketplace plan, you can have a 90-10, you can have a 70-30 or 60-40. So it just depends on the type of plan that you have. But the larger amount is what the insurance company pays, and this smaller amount is you. So if you have an 80-20 plan, the insurance company will pay 80% of the cost, and you pay 20% of the cost. Okay. And then the last thing you want to pay real close attention to is the out-of-pocket maximum. Okay. And so this is the amount that you will pay out of pocket for the year. Okay. So health insurance runs from January to December. And so if your out-of-pocket maximum is, say, $5,000, once you hit $5,000 on covered services, and these are services that are subject to the deductible. Okay. So once you hit $5,000 on that for the year, then the insurance will pay 100% of those costs for the rest of the year. Now, normally this does not include doctor's visits or prescription drug coverage. But you want to make sure you read your summary of benefits, because that tells you what is subject to the out-of-pocket maximum. Okay. Now, the summary of benefits usually includes a chart that lists, common medical service, the most used medical services, such as doctor visits, lab tests, hospital stays, prescriptions, maternity care, and preventative care. So you want to also pay attention to the not covered section. Okay. And see, this is the section that when you don't pay attention to this, when you don't know what's not covered, you will have something done, and then you will come to find out that, it's not covered. And so then when you find out that it's not covered, you are responsible for that cost at 100%. Okay. Now, things like preventative care, so like your mammograms and your annual checkups, birth control, those types of things are covered at no cost. But services like dental, vision, or alternative therapies are normally not included unless you have additional coverage, like through a dental or vision plan. Okay. All right, so I'm going to now share my screen so that I can go to, I'm going to go through an actual summary of benefits so that you can see. I can break down. I'm going to go over exactly as if I was. I hope it's like back. Hold on. Okay, there we go. It's still live. Okay, great. All right, so let's try this here. Share. Okay. All right. Here we go. So this here is a this here is a summary of benefits through the marketplace. Okay, so if you have your insurance through the marketplace, it's like now if you have Medicare, it does look a little different, just depending on the carrier, but the information is pretty much still the same. Okay, so first thing you see here is the name of the company and the plan name here. Okay. Now this is important because when you go to the doctor, you need to make sure that your doctor actually accepts this plan. So even if they accept the insurance, some doctors don't accept all of the plans within the insurance company. So you have to make sure that the actual plan that you have is one that is accepted by whatever provider you are wanting to see. Okay. Now over here, it also says the types of plan. So this one here is HMO and it does have the coverage period. Okay. And now when you look here, this first section here, this talks about the deductible and the out-of-pocket limit and the network. So like for this particular plan, this WellPoint Essential Bronze 7500 standard plan. The overall deductible for this is $7,500 per person or $15,000 for a family. Okay. Now, you want to make sure if your plan is a family plan, okay, and it's $15,000 per family, you want to make sure that that you understand how the family plan works. Because for some plans, once you meet the $15,000, then it kicks in, and you don't have to pay anymore. For other plans, each person has to meet their own individual deductible. So like for this plan here, it says if you have other family members on the plan, each family member must meet their own individual deductible until the total amount of deductible expenses paid by all family members meets the overall family deductible. So if there's 3 people on here, okay, and on this plan, each person needs to meet the $7,500 in person deductible before the family deductible is met in order for the plan to pay 100% for the year. Okay. And this is only for in-network providers because this is a HMO plan. So you do not have any out-of-network benefit. Okay. So if you go out of network with the HMO plan, it will not be covered. Okay. Now here it talks about the services that are covered before the deductible is met. And so this would be primary care, specialist visits, preventative care, and certain prescription drugs and vision. Okay. So here you see here, it does let you know that some services will be covered before you met the deductible, but a copayment or coinsurance may apply. Okay. And so you just need to you read this here because this explains this, okay? Now, this here is very key because some plans do have a health deductible and a drug deductible, okay? So you want to make sure here that there's only one deductible on the plan that you are choosing. Because if this says yes, then they will let you know that there may be a drug deductible. Okay, so say for instance, it'll say yes, and then it'll say health deductible. Let's say it's 5,000, and then drug deductible. Let's say it's like 500, which means you have to pay $500 of the prescription drug cost before the plan will kick in and pay their portion. But with this plan, there is no other deductibles outside of the overall deductible. Okay. All right. Now, the out of pocket limit, which is the most that you could pay in a year for covered services. And so per person, it would be $9,200. So once you hit $9,200, then, you're good to go. And you've met your deductible. You've met the deductible, plus you've reached the max amount that you're going to have to pay out of pocket for covered services. Now, if you are in a family, then that is $18,400. Okay. However, you need to make sure you read over here, because with this plan, everybody has to meet their own out-of-pocket limit until the overall family out-of-pocket limit has been met. So ideally, you could be paying more than $18,400 if $9,200 is the in-person out-of-pocket limit, and there's 3 people here. Then each person has to meet that $9,200, which means you would then meet the $18,400. Okay. And it, once again, is only for in-network providers. Okay. And so this here tells you what's not included. Remember earlier I spoke about everything isn't included in the out-of-pocket limit. And so here it lets you know that premiums are not included in the out-of-pocket limit. Balance billing charges are not included. And any charges that the healthcare plan does not cover. Okay. And so even though these are expenses that you do have to pay, they do not count towards the out-of-pocket limit. Okay. And then this just is letting you know that if you use a network provider, that you'll pay less, even though this doesn't cover any out-of-network providers, but they still put it on here anyway. Okay, and then this here is very key here. Do you need a referral to see a specialist? Because depending on the type of plan, you may need a referral. Some HMOs do require referrals from your primary care before you can go and see a specialist. However, this is an HMO plan, but it does not require a referral. And so you can go and you can see a specialist without a referral. So this first page of the summary of benefits is very important because it lets you know exactly what you will be paying out of pocket when it comes to your deductibles and your max out of pocket. And it also lets you know, what is covered as far as in and out of network. Okay. Okay. Now this here is also, you want to pay attention to this right here. Where it says all copayment and coinsurance costs are subject are after the deductible has been met if a deductible applies. Okay, so as you see here, to go to the primary care, it says it's $50 per visit. Notice here it says the deductible does not apply, meaning that when you go to see the doctor, you can just pay the $50. You don't have to meet the deductible first. If it does not say that the deductible does not apply, then you have to meet the deductible first. And then once you meet your deductible, then the copayment will apply. Okay. And so this little sentence here is very key. You want to make sure that uh, it says that. Okay. Same with the specialist. For this one, it'll be $100 visit, and the deductible does not apply. Now, preventative care, there's no charge for that. Also, here, under the limitations, exceptions, and other important information, if you wanted to do telehealth, it is covered. Okay. Now here, if you need to have any x-rays or blood work done, you see it says 50% coinsurance. Okay. So again, going back up here, it doesn't say deductible does not apply. So you're going to have to meet the deductible before the coinsurance goes into effect. And the same thing, if you were to need an MRI, you would have to pay the full cost of however much. Now, normally when you go and you get any services done, um, it is at the network contracted rate, meaning that the cost of somebody who walks in off of the street that does not have insurance is different from the cost that somebody who has insurance would pay, because you are paying the network contracted, in that because that imaging center or that like somewhere like Quest Lab, because they are contracted in network, you get a discount off of what they would charge if you had no insurance. So you are getting a little bit of a discount. It is a little bit cheaper, but you still have to pay the full price before you will get the 50% co-insurance. Okay. Now, when you're looking at your medications here, medications are per tier. And so the lower the tier, it's normally like for the cheaper, less expensive, or more common medications. And then the higher the tier, it is for the specialty medications. Okay. So like on this here, you see the generics, which are normally like tier ones. It's $25 per prescription, and the deductible does not apply. And so this is for retail, meaning that if you go into the pharmacy and pick it up, and then if you wanted the mail ordered or the home delivery, it would be $75 per prescription, and the deductible does not apply. So it's not subject to the deductible. Okay. Now for tier two medications. These are like the preferred brand or the non-preferred generic drugs. These are the ones that they may still be common, but they, are classified a little on a different higher tier level. They might not be as cheap to make as the generics. And so for these, it would be $50 per prescription. But as you see, it doesn't say subject to, it doesn't not apply, which means these are subject to deductibles. Okay. Same thing with tier 3s and tier 4. Okay. If you need outpatient surgery, this would be 50% co-insurance after you meet the deductible. The same with if you need to go to the emergency room, or if you need an ambulance. Now here, as you can see, even though this is an HMO plan, because it is emergency care, if you go to a hospital if you go to an emergency room that is not in network, it will be covered the same as if it were in network, because it's emergency care. Okay. Now, urgent care. If you need urgent care, it's $75 per visit, and it's not subject to the deductible. So you would only just have to pay pay the $75, and it is, if it's a provider that's not in network, it will still be covered as if it is in network, and so you'll only have to pay the $75. Okay. Let me check here and see if there's any comments. Okay. All right. Okay, now if you go to the hospital, um, you have to make sure that the hospital is in network, because if the hospital is not in network, it will not be covered and it is subject to the deductible. Now, for your mental health, the office visit is covered. It is not subject to the deductible. However, any other outpatient services that you would need is subject to the deductible. And if you need to have an inpatient stay at a mental health facility, you would have to meet the deductible first. And then afterwards, it would be a 50% coinsurance. Okay. Um, Maternity visits are covered, but they are subject to the deductible. Um, Now, if you need home health care, that is also subject to the deductible. And you have to look here um, to see how many visits, if you need home health care, how many visits are covered. And so it's 60 visits a year. And you have to make sure that it's a in-network provider. If the provider is not in network, it will not be covered. Okay. Um, Now, as far as rehab, if you were, say you were in a hospital and then you got out and you needed rehab afterwards, it would be covered 50%, $50 a visit. It's not subject to the deductible. Any habilitation services as well, $50 per visit, and it's not subject to the deductible. Now, skilled nursing is subject to the deductible, and you only get 25 days a year for skilled nursing services in network. Okay. Um, Durable medical equipment. So this would be things like oxygen, or if you need a walker, or if you need a wheelchair, or like a hospital bed, anything like that. It's a 50% coinsurance, but it is subject to the deductible. The same with hospice services. If you needed hospice, um, it's a 50% coinsurance subject to the deductible. If you have children on your plan, um, eye exams for children, glasses for children are covered at no charge, but dental checkups are not. So you would need an additional dental plan for them. Okay. And vision is only covered for children, not for the adults under this plan. Okay. Now, this page here is important because it tells you what is not covered. So you can see here, all of this stuff here is not covered. And then this here, it shows things that are covered, but there may be some limits to the services. So you can get chiropractic care and you can get a hearing aid. Okay. And then it tells you, if you have a grievance or if you want to appeal. And then these here, it shows you, kind of gives you a little bit of a breakdown on different types of things and how the plan would pay for each one. So this one is showing about having a baby. This one is managing type 2 diabetes. And then this one would be if like a fracture. So it's like an emergency. This is routine. And then this is maternity. Okay. And then that's it. Okay. All right. So that's what a actual summary of benefits looks like. And so that's how you actually read the summary of benefits. Okay. Now, when you are looking at a summary of benefits, when you are looking at, say, your current plan for 2025, and then you are comparing it for 2026, you do not want to just look at the premium. I see a lot of people make this huge mistake, especially with the marketplace. They go in and they're excited about a $0 premium plan, only to find out that when they go to use that plan, that they are having to spend way more out of pocket than they would like. And so you need to really pay attention to the actual cost. You need to go line by line. You also need to do a health needs assessment on yourself and think, okay, how much did I actually use my plan this year? Okay. And then you need to look and try to forecast, okay, how much do I think I'm going to use my plan next year? Okay. Now, if you are generally healthy, you might think I just need a plan for, preventative care, or you need to say, hey, I have ongoing medical needs and this is what I spent this year. If I can get those needs to stay where they are, this year or under, that would be great. And so then once you assess your needs, then you can go and look into a plan that would really cover your needs. Just picking a plan because of the premium is horrible, and I do not recommend it because you really will end up spending more if you need to use that plan during the year. Okay. All right, so here's just a few tips to help you when it comes to looking at your health insurance and the summary of benefits. So the first thing you want to make sure you highlight the top 5 things on the summary of benefits, which is your premium. Well, that one's not on the summary of benefits, but you need to know the premium, your deductible, your copay, your coinsurance, and your out-of-pocket maximum. Okay. You also want to keep your summary of benefits handy. Okay. So whether that is you have it in a folder on your phone or on your computer, so that when you are ready to go to the doctor, you know exactly how much you're going to be spending, or whenever you're having any types of procedures or anything done, you know exactly how much you are going to be paying out of pocket. Okay. Now, if you are unsure about any of your costs or anything, you need to call your insurance broker or agent and ask questions about your specific needs. Okay. There's no need for you to try to figure it out alone, especially if you have a dedicated broker that you work with. Then you need to reach out to them and be like, hey, I have questions about my health insurance. Can you help me with that? And so you, like all my clients know, they can text me, when they have questions, or they can call me, email me. I'm, always available to answer any questions that they have. And so if you do not have a broker and or an insurance agent that you work with and you need one, you can definitely book a complimentary consultation with me. We can do a health needs assessment for you. And then we can look into, what it will be in the future, what you think your needs will be. And then as open enrollment comes, we can look and get into compare the plan that you currently have to the plan that you have to the plan that you're looking at in 2026, and see, how they compare, or if you, may need to change and find a different plan. Okay. All right. So now you know how to read your health insurance summary of benefits. And so you're not going to be overwhelmed because I just showed you. Now, if, going forward, you're like, oh my gosh, I don't even remember. How do I read this? Come back to this video, to this live, and read it. Now, let me know, do you have any questions? And if you do have any questions, please pop them in the chat. I will, even if you're watching this on the replay, I do always come back and I answer questions. I go through the questions and I answer the questions. So feel free to always pop them in the chat, okay? Now, I want you to remember that your health and wealth go hand in hand. And so understanding your health insurance benefits is the first step in protecting both of them, okay? All right. And so if you've made it this far, thank you so much for watching, for jumping on. I so appreciate you. And so my goal is to always provide practical, actionable financial advice to help you to take control of your finances and your future. And so now, if this video provided you with value, please do give it a like and share it out. with your business bestie, your water cooler homegirl, or anyone who needs to hear this information. This is really important information. And so you definitely, share this out so that people will know exactly how to read their summary of benefits and know exactly how much they will be paying for their health insurance, okay, when they go to use it. Now, if you want to continue to learn how to grow, protect, and secure your money, then go ahead and subscribe and click the bell so that you get notified when I go live or when I upload new content to the channel. And if you would like more guidance outside of the content that I provide, or if you would like to book a complimentary consultation with me, then you can click the link in the description of this video, of this live, and I will, and then you can definitely get that. Okay. All right. So remember that the way to secure your financial future is to protect it now, because tomorrow is definitely not promised. Okay. Now, in the description, I'm going to have another video that I recommend that you watch, and it's 3 things you need to consider when choosing your health insurance. It connects perfectly to what I just covered today. And so the link will be in the description. Okay. Have a good one. See you on the next video.